DEXA measures bone density in the spine, hips, and forearm because they represent the most common sites of fragility fractures. Osteoporosis often goes unnoticed because it cannot be detected by a normal X-ray until 25% to 40% of calcium in the bone is lost. DEXA is considered the gold standard of BMD studies. DEXA is also useful to evaluate changes in bone density over time and assess effectiveness of osteoporosis treatment. Serum calcium, phosphorus, and alkaline phosphatase and vitamin D labs can be done. Alkaline phosphatase may be higher after a fracture. Bone mineral density, also known as BMD measurements, determined by peak bone mass and amount of bone loss. BMD test results are compared to the ideal or peak bone mineral density of a healthy 30-year-old and reported as T-scores. A T-score of 0 means the BMD is equal to the norm for a young, healthy adult. Differences between the BMD and that of a healthy young adult norm are measured in units called standard deviations. The more standard deviations below 0, indicated as negative numbers, the lower the BMD and the higher the risk of fracture. A T-score between +1 and -1 is considered normal. A T-score between -1 and 2.5 indicates osteopenia, which is bone loss that is more than normal, but not quite at the level of the diagnosis of osteoporosis. A T-score of -2.5 or lower indicates osteoporosis. The greater the negative number, the more severe the osteoporosis.